So for today, we have a number of new cases. We're reporting on the cases that have tested positive since our last briefing on Saturday morning. The number of new cases is 48, giving us a total number of test positive cases of 472 here in British Columbia. Of those, 248 are in Vancouver Coastal Health, 150 in Fraser Health, 39 on Vancouver Island, 30 in Interior Health Region, and 5 in Northern Health Region. Of those, 33 people are currently hospitalized, and 14 of those in hospital are in the intensive care unit. In addition, we've had 3 additional deaths over the last 2 days. One, a resident of the Lynn Valley Care Centre, one, a resident of Harrow Park, unfortunately, and another a community dwelling resident in the Fraser Health region. So we're very saddened, of course, by the passing of these people. On a more positive note, we have finally got enough testing and symptom resolution back to be able to say we now have 100 people who have been considered recovered and released from isolation. So that is a really good thing to be able to put that on our books finally. As I have mentioned, many of the people who have tested positive had had very mild illness and have been recovered for some time. So the criteria for being able to allow them to come out of isolation has finally been met for most of them now. In addition, we have 6 now long-term care facilities that have been affected by COVID-19. The Lynn Valley Care Centre, we now have 36 residents and 19 healthcare workers who are affected there. Hollyburn is the same. The Harrow Park has increased by a few. We're now have 10 residents and 12 healthcare workers who have tested positive at that facility. The 2 new facilities are the German Canada House in Vancouver Coastal Health, where 1 staff person has been affected so far, and an outbreak response is ongoing at that facility, and the Delta View Long-Term Care Centre in Fraser Health. Again, 1 staff person was identified as positive, and a full outbreak response is happening at that facility as well. We have been working diligently in our lab system, and as we've talked about over the last week, it has been a challenge for the lab to keep up with the volume of testing, and we've done over 18,000 tests, as you're aware, and the backlog of testing that had accumulated over the past week and a half is mostly resolved, and we're hoping it will be completely resolved by the end of today or tomorrow, so that is great. We've also ramped up the capacity so that we're able to test as widely as we need to. We have changed our criteria for testing, as you know, to focus on healthcare workers, on long-term care, on clusters and cases in the community that are not linked to travel, where we recognize that for the large number of people who have traveled back to British Columbia from outside Canada, the self-isolation is what they need to do, even if they have mild symptoms, and they do not need to have a test in those cases. We will be posting, of course, the testing numbers as well on a more regular basis as we in the coming days. I also presented some information about both the testing curve, but also what we call the epidemic curve with the onset of illness on Saturday, and that information will be updated on a daily basis and will be posted on the BC CDC website. I know there has been some concern expressed that our change in our strategy for testing means that there's a bunch of cases that we're actually not getting to, or that we're not recognizing in the community. And while we do recognize that people who have symptoms and they've had an exposure may have this disease. It doesn't mean that everybody needs to be tested, but we will be posting what we call epidemiologic linked cases as well. So if I'm in a family, for example, and one person in the family has tested positive and I develop similar symptoms and able to be managed at home, we don't necessarily need to test you, but we'll call you a case, an epidemically linked case. So we'll be posting that information as well as we get that information going in our epidemiologic summaries. So that will give you a better sense of the numbers of people who have been affected by this disease here in BC. So there has been, as I'm sure everybody in this room is aware, monumental changes in the past week across British Columbia, across all of our communities, in trying to put in place measures to physically distance people and ensure we're doing everything we can to slow down and stop the transmission of this virus in our communities. And for the most part, despite what we've been seeing on social media and some of the concerns that are expressed, people are doing their part. But we cannot let up. And we do need to be sure that we're addressing some of those issues that we have seen with people congregating in groups and often outside where it's very visible. So I'm, again, ensuring that people that it is okay. If you're not in self-isolation, yes, you can go outside, but go only with your family members in small groups. Maintain those distances. It is important for us to keep our health and mental health going as well through this. And we also need to maintain essential services. And I know there's been some, I've been receiving reports that people are confused about what they need to do and how they need to do it. But it is incredibly important for us that all of us can manage this only by making sure that we have essential services going. So things like our grocery stores are essential, our banks, our pharmacies. But we need to have safe measures so that we can all get the food that we need, get the medications we need in a safe way. And I know many, many places are taking those measures, and I'm really heartened by that. So we'll be working with them to make sure that we have those things in place to best protect everybody, but continue to be able to support each other and to work on and to ensure we have what we need to get through this next few weeks to months. I also want to talk about the importance of doing these things to protect our healthcare workers and our healthcare system. As we know, healthcare workers are really the heart of our response to this pandemic, and they face risks both in the community and at work. So those community measures we are taking are incredibly important for protecting our nurses, our doctors, our care aides, the people who work in all of our healthcare facilities as well. In addition, as you know, we have a number of long-term care homes that have been affected, and we know that people in long-term care are of the most vulnerable for having severe illness with COVID-19. So the health authorities, particularly here on the Lower Mainland that are most affected, will be implementing additional measures at long-term care. And I know that this will be a challenge for some people in our community because you will not be able to see your loved one as simply and as easily as we have in the past. And I know the long-term care homes are going out of their way to try and put in provisions to allow you to connect, even if you're not physically present. We also will be screening long-term care workers as they come into work every day and providing clear guidance on the use of personal protective equipment to protect themselves, their colleagues, and our patients. I also am appealing to my colleagues in healthcare that we need to really have a heightened awareness of our symptoms. We've been saying from the very beginning that many people, especially young, healthy people, which most of our healthcare workforce is, can have very mild symptoms. And we can pass it on to each other when we're in the break rooms, when we're working together on the ward, and we can pass it on to our patients. So we need to have a heightened awareness of even very mild symptoms and ensure we take the physical distancing measures that we need and are able to maintain our services in a safe way. And so I mentioned already that we shared the epidemiologic curve, and more information will come, but we still need to work together to flatten this curve. Every day that you and your family stay distanced from others and follow the important things that we talked about from the very beginning of this, cleaning our hands regularly, covering our mouth when we cough, enhanced cleaning measures in our community and in our homes. The more that we do this, the better prepared we will be for the coming days and coming weeks. And we must do everything possible every day to protect our communities and protect our loved ones.